Hi, this is Dr. Karima Hirani. I am a board-certified family physician with a master's in nutrition and a practicing DAN doctor since 2001. Today I'm going to talk to you about the biomedical treatment approaches for autism. What is the biomedical approach? It basically utilizes nutrition, including dietary changes and supplements, detoxification, methylation. It utilizes cutting-edge experimental therapies that have been found to be quite effective for children on the spectrum. And it's definitely something that you want to consider alongside conventional treatments. In my practice, some of the children that have done the best are the ones that are doing the biomedical alongside the behavioral therapies, the speech, the physical therapy, occupational therapies, etc. If conventional treatments have been unsuccessful to your child, again, this is something that you definitely want to consider. The advice that I give to parents or prospective parents would be to talk to other parents that are already utilizing these approaches. A good place to find them would be takanow.org and Generation Rescue, especially since this is not the standard of care. And when you talk to parents, such as those whose children come to my practice, this will reassure you that this approach may perhaps be very beneficial to your child. The gluten-free, casein-free diet is probably the most effective diet and in the top 5 most effective biomedical treatments. Gluten is found in wheat, oats, spelt, rye, barley, and kamut. Gluten-free examples are rice, buckwheat, quinoa, amaranth. Almost every almost everything you can imagine is available in gluten-free at your local health food store and even in regular stores. Casein is found in most dairy products such as cow's milk, goat's milk, cheese, yogurt, butter, ice cream. Casein-free is found in rice milk, nut milk, potato milk. Notice how I have not mentioned soy milk because a lot of children are intolerant to soy milk. Sugar-free is also a very effective biomedical treatment approach. When I tell my parents to look at the parent ratings sheet, they will see that the Candida diet or the sugar-free diet is top 12 most beneficial, and diflucan on the parent rating sheet is also very high. It's top 10 most beneficial. So what this basically is indicating is that these children have yeast issues. So when you feed the child foods that contain sugar, you're feeding the yeast or the Candida and you're feeding the autism. Sugar-free means avoiding juices, soda, too much fruit, refined carbohydrates like chips, pretzels, cookies, crackers, etc. You can find some dietary resources going to drhirani.com, generationrescue.org, takanow.org, and Special Diets for Special Kids, which is a 2-volume book. And there's certainly no harm in trying these diets, especially if your regular doctor has not endorsed it. By talking to other parents that are doing this diet, that may reassure you. But again, just to reiterate, there is no harm in trying a sugar-free diet as there is no harm in trying a gluten-free, casein-free diet. The need to go organic. Why? I tell my parents that the rates of autism have climbed substantially in the last 15 to 20 years. The rates back then were 1 in 10,000, and today we're looking at rates of about 1 in 50. So what has changed over the last 15 to 20 years? Your genes don't change that drastically over a period of 10 to 15 years. What the experts tell us is that we're dealing with a genetic susceptibility and an environmental trigger. So what is that environmental trigger? I believe there are many, and one is possibly pesticides. A study done in Central California showed a connection between pesticide exposure during pregnancy and higher risk of autism. So what they looked at was the locations where the pregnant women were living, and the closer they lived to high pesticide spraying, the higher the rates of autism they had. So my recommendation is to find a farmer's market near you, or of course, grow your own organic vegetables and fruits. And if you can't, then farmer's market. And buy your produce there and use a local organic supermarket to buy your meats. Try to eat as whole foods as possible and avoid packaged and processed foods. Supplements. The targeted supplements seem to benefit these children most likely because of the nutritional deficiencies that they have. Part of this is due to the limited diets that they have, or the excess need based on genetic variations, and we do have some testing that can point to this. Melatonin is a super antioxidant and the top 5 most beneficial biomedical treatment, and it's highly recommended for children with sleep problems. What we tell parents is that we know that there is brain inflammation going on with autism, and antioxidants reduce inflammation. So this may be one of the mechanisms by which melatonin is providing so much benefit to these children. Fish oils or omega-3 fatty acids are also top 10 most beneficial and have been studied in this population of children with good results. So fish oils are definitely highly recommended. DMG stands for dimethylglycine. It's an amino acid glycine attached to 2 methyl groups, hence the word dimethyl. 40% of the children benefit in the area of language through supplementation, so highly recommended for children with language issues. Vitamin B6 and magnesium helps about 50% of these children. There is a multivitamin made just for these kids that is high in B6 and magnesium called Super Nuthera, which I like to recommend. Calcium is recommended if the child is casein-free and not receiving a non-dairy milk that is fortified with calcium. This is not a complete list. These supplements are only part of the beginning of the biomedical treatment approach. In many cases, once lab results come back, they may indicate need for more vitamins, etc. So your doctor may recommend biomedical testing to determine individual need. Digestive enzymes are targeted to contain the DPP4 enzyme. The DPP4 enzyme is what digests the gluten and the casein. And it has been thought that perhaps the DPP4 enzyme is not working as well as it should be in some of these children. So when they ingest these proteins, instead of being properly digested, they're actually converted into opioid-like molecules, and they have an opioid-like effect on the brain, almost like a heroin type effect. So these children are in their own worlds. So when you start them on the diet, you will see some improvements in the area of eye contact, language, and socialization. Now, why give the child an enzyme formulation with DPP4 if he or she is on the diet? The reason for this is because there may be some hidden gluten or casein in the diet. Another reason is that the digestive enzyme formulations that most stand doctors will provide you with or recommend are global digestive aids. They will help digest all the proteins and carbohydrates and fats in the child's diet. These enzymes are usually taken with meals. Probiotics or friendly bacteria will help improve bacterial imbalances and restore gut function. We do biomedical testing that will determine if the child is low, and almost invariably the child is going to be low in friendly bacteria, and hence we will recommend supplementation. B12 shots are subcutaneous. This means under the skin and not IM or intramuscular. B12 shots are non-toxic and the top 5 most beneficial treatment. Children will get these anywhere from 2 times a week to every day. I have seen some miraculous improvements with children getting B12 shots from going from 10 words of vocabulary to a 100-word vocabulary in a matter of weeks. The B12 sublingual supplement is over-the-counter and is an alternative when the shot is not available or refused by the patient. However, you must be aware that it is less effective than the shot. The B12 shot must be prescribed by a physician. Food allergies and intolerances. Addressing food sensitivities is top 10 most beneficial biomedical treatment. This is usually done by a blood test. It is not a routine conventional test. It must be done by a specialty laboratory. And you may contact my office to do just this test as a standalone with a brief consultation at a reduced fee for patients who cannot afford to see me. The food allergies or food intolerances test looks at about 100 different foods, and it includes IgG and IgE antibodies. And they test some of the most commonly eaten foods, vegetarian foods, spices, molds, inhalants, and finally celiac or gluten intolerance, which, by the way, a lot of children turn out to be gluten intolerant. Hyperbaric oxygen therapy. This is mild oxygen therapy, or MHBOT, given in a chamber where filtered room air is provided at a pressure to increase oxygen concentration. The parent usually accompanies the child. The child believes that he's going into a submarine, and they usually take their iPod or iPad or portable DVD player, and they can keep themselves occupied for about an hour. That's how long the treatment lasts, and it must be done back to back for 40 days. It is the top 10 most beneficial biomedical treatment. The published research, however, has been conflicting, meaning some research has shown benefit and some research showed no benefit. In my practice, majority of the children benefit tremendously. The chamber we use is FDA approved for acute mountain sickness. Neurofeedback. Published research showed benefit especially in high-functioning autism. This was a study done at UC San Diego in 2008 by Dr. Pineda. And what he found is improvement in social, especially. At least 30 sessions must be tried at a minimum of 3 times a week. The therapy is non-invasive. Some electrodes are gently pasted to the scalp, and these electrodes are monitoring his brain waves, and we use this information to set a reward frequency to which the child is training his brain to work at, and he doesn't know it, but he's actually learning to self-regulate. The machine we use is FDA approved for relaxation. Heavy metal detoxification. This is probably the most effective biomedical treatment and also the most controversial. In my practice, it is the #1 most beneficial. If you look at the parent ratings, which, by the way, you can access by going to autism.com, you will see that it is the #1 most beneficial. And if you were to talk to DAN doctors who are providing heavy metal detoxification across the country and across the entire world, you will hear the same thing from them. So the treatments utilized have been around for more than 50 years with established safety when administered correctly, some of which are FDA approved for lead toxicity. DMPS, which is used for mercury toxicity, is not FDA approved, but very safe, and so doctors are allowed to prescribe it to patients. Careful monitoring is a must, and this includes blood testing for blood count, liver, kidney function, anemia, and mineral levels, including iron levels. Heavy metal detoxification requires a trained medical doctor to administer. Side effects of treatments. Going strict on the diet may produce some irritability, as these foods can bring on a withdrawal type reaction in the child. And so we usually recommend the parents to go slowly with the GFCF diet. However, there are always some parents who will go cold turkey and they will experience these side effects more drastically. Melatonin is very rarely can cause nightmares, and if this happens, the melatonin needs to be discontinued. DMG, B6, magnesium, and B12 may bring about hyperactivity, which in most kids is usually short-lived. HBOT and heavy metal detoxification may bring out yeasty behaviors or stir up the yeast in the short run. And these kinds of behaviors include inappropriate laughter, stimming, crying easily, very emotional, and aggression. So we definitely tell parents to watch out for these kinds of side effects. Heavy metal detoxification may also cause mineral depletion, And for this reason, we monitor the children very carefully by blood work, and we also supplement with a mineral supplementation during heavy metal detoxification. Warnings. This information is provided for educational purposes only. It is not meant to replace any of the advice given to you by your physician. I highly recommend that you seek professional medical advice from a DAN doctor or from your regular physician before embarking on the biomedical treatment approaches. I hope you found this slide presentation helpful. And you may visit autism.com for parent-reported outcomes and drharani.com for links to articles mentioned. I wish you all the best.